the billion-dollar map to optimizing and assessing each organ. If your blood tests are normal, but you feel fatigued, foggy, inflamed, or flat, you don't need reassurance, you need remapping. At BDV, we look at end organ symptoms in our 360 approach and testing over 650 biomarkers. For sleep is where you optimize your immune system, where growth hormone, the elixir of youth, is produced, where your gut produces serotonin, and your memory and thoughts are laid. We assess cortisol rhythm, heart rate variability, and sleep stage distribution. We treat with neurofeedback, IV NAD, brain-targeted peptides, and IV ozone to reduce neuroinflammation and optimize repair. For mood, anxiety, and overthinking, these are often neurochemical, not psychological. We assess the HPA axis, neurotransmitter metabolites, and inflammatory markers. We treat with peptides, increasing the dopamine and serotonin support, the happy hormones, hyperbaric oxygen therapy, neurofeedback, and EBU to clean the debris in the brain. For optimal cognition, focus, and performance, these reflect mitochondrial inefficiency and reduced neuroplasticity. We assess with EEG mapping, heart rate variability reactivity, and mitochondrial function. We treat with IV NAD, transcranial direct current brain stimulation, peptides such as pinealon, and exosomes for synaptic regeneration. For energy and fatigue, this is driven by mitochondrial dysfunction, poor recovery, and physical decline. We assess all hormonal panels, nutrient cofactors, oxidative stress, and ATP or energy production. We treat with IV ozone, peptide stacking with MOTC and SS31, IV stem cell infusions, and TPE to remove all the bad stuff. For immune resilience, if you suffer from frequent infections, post-viral fatigue, chronic inflammation, we assess inflammatory markers, immunoglobulins, and long COVID markers. We treat with peptides, thymosin alpha-1 and LF37, high-dose IV vitamin C, IV ozone or EBU, or even TPE for full immune reset. For gut health, gut dysfunction affects immunity hormones and brain function. We assess with GI mapping, leaky gut markers, SIBO testing, and food sensitivity markers. We treat with IV NAD, glutathione, targeted probiotics, and stem cells for severe dysbiosis. For fertility and hormonal longevity, irregular cycles, low libido, and infertility reflect systemic hormone dysfunction. We assess all hormones, including AMH, FSH, LH, testosterone, semen analysis, MTHFR or COMT genes. We treat with kisspeptin and buserelin peptides, PRP to the ovaries and testes, IV mesenchymal stem cells, and exosome therapies. For loss of libido, sexual decline is vascular, hormonal, and neurological. We assess all hormones, for example, testosterone, estradiol, HPG, also nitric oxide levels and vascular markers. We treat with peptides such as PT141, PRP for optimal orgasms, genitome, exosome injections, and pelvic ozone. For metabolism optimization and weight, where you have insulin resistance, midsection fat, and muscle loss, accelerating aging, we assess fasting insulin, leptin, adenopectin, and genetic metabolic markers. We treat with GLP-1, GIP agonists such as Mounjaro, Ozempic, Wegovy, peptides such as CJC, ipamorelin, IV NAD, TPE. These all reset inflammation-driven metabolism. For longevity, we assess biological age via epigenetic clocks, glycan profiling, and chronic inflammation. We treat with NAD cycling, stacked peptides, IV exosomes and mesenchymal stem cells, TPE or plasmapheresis for immune recalibration and neurostimulation. At BDV, we don't guess, we test, track, treat, and transform. Because aging, well, it isn't a trend, it's a protocol.